I'm the research director for AI ethics in health here at the JCB, and I'll be the moderator for today's session. Our speakers today, as you know, are Dr. Peter A. Singer and Dr. Jennifer Gibson, and the seminar is titled Imagining the Future of Bioethics, Reflecting Back, Looking Forward, an Interactive Exploration. So we'll look forward to hearing from all of you today. Before I introduce the speakers, I'd like to open our session in a good way by acknowledging the lands that we currently occupy and that University of Toronto operates on. As we all know, it's the traditional land of the Huron-Wendat, the Seneca, and the Mississaugas of the Credit. It's home to many diverse First Nation, Inuit, Métis peoples in present day, and it's a real privilege to live and work on these lands. The format for today's seminar is an opening conversation by our speakers, followed by our interactive discussion with anybody joining online via YouTube, and also those of us here in the room for today. So now it's my pleasure to introduce our speakers. Probably they need no introduction, but it's important to do, certainly. Dr. Peter Singer is a leader in global health and innovation with over 35 years of experience in building innovative institutions oriented toward impact, social impact. He's currently a board member of Grand Challenges Canada and the Israeli Foundation, and a professor emeritus at University of Toronto. From 2017 to 2023, he served as special advisor to the Director General of the World Health Organization. As co-founder and prior to that, he was co-founder and former CEO of Grand Challenges Canada, and co-founder and former director of the JCB. Dr. Singer is an officer of the Order of Canada, a fellow with the Royal Society of Canada, among many other accolades. He's a highly accomplished researcher and leader, and this is a highly truncated bio, as you can imagine. Dr. Jennifer Gibson is the Sun Life Financial Chair in Bioethics and Director of the JCB. She's an Associate Professor in the Division of Clinical Public Health and Health Policy and Management here in the Dalla Lana School of Public Health, and Director of the WHO Collaborating Center for Bioethics at University of Toronto. Jennifer holds a PhD in philosophy, bioethics, and political theory. She's a health policy ethics scholar whose research, teaching, and policy work has focused on ethical issues in contemporary health institutions and systems, and the role of values in health policy making at different levels. And she's been involved in policy consultation locally and internationally as well. So Peter and Jennifer, welcome to today's seminar. I'll pass it over to you.
Thanks so much, Jay, and thank you all for joining, either in person or online. We're really delighted to have you here. And so it's really a special opening seminar for us because Peter, Ross Upshur, and myself, as the remaining living JCB directors, have come together with colleagues, some of whom are in the room and online, to start to envision what bioethics and what the Joint Center for Bioethics may be as we move into its 30th year, which is in 2025. So really, we're seeing this as an opening of a conversation about bioethics and the future of bioethics, but also an opportunity to reflect back on where we've been, to be able to reconnect with each other in our local community right now and across space and time, given how many graduates we have around the globe right now. And then also to be thinking about renewal. So where do we go from here as a field in bioethics? And also, where could JCB go in the future? So we really see this as an opportunity to start a conversation with all of you about what that might be. And so really, I think what Peter and I are envisioning is a little bit of a conversation about this, but where we've been, where we are, where we're going, and then really to pass it over to you to be able to feed in your thoughts and reflections as well. So maybe I'll just kick things off and just say, Peter, to be honest, I have a hard time believing that it's 30 years. In many ways, it just feels like yesterday that I was your graduate student, one of your graduate students, at the JCB. And honestly, I don't think at the time I appreciated how new and innovative the Joint Center for Bioethics was. I mean, my experience as a graduate student was, wow, this is exciting and it's enriching and it's interdisciplinary and it's interprofessional, and the buzz was really quite powerful, and there was this great optimism that we might be able to do something different. But now with with the 30th anniversary approaching, I've started to wonder, like, what was going on at that time? Like, well, how did you end up in doing what you're doing, and how did the JCB actually come to be?
Jennifer, thank you. And let me just say a warm hello to friends in the room and online. It's so wonderful to be here with you. I'm so pleased to celebrate JCB's 30th anniversary. It is a little bit surreal that 3 decades have passed, but also something I think we can all be very proud of. And I'm really thrilled with the themes of this anniversary year, and look forward to engaging deeply with people around those 3 R's of reconnecting, reflecting, and renewing. A lot of happy memories and also great potential. This 30th year thing got me reading this first 10-year report. You see the church there. And it's just such a happy thing, but also something with impact. So to your question, Jennifer, in the 1980s, bioethics was a very hot topic, but it had a particular feel, almost of a protest movement, a critical movement from outside the profession, mostly. The thesis of the Joint Center for Bioethics was to preserve the academic rigor and the needed push from outside the profession, and combine it with the development of tools and training inside the health professions, with a singular goal of improving the care of patients. That was the thesis. Just to capture that in a story that very much affected me, when I was doing my internship in 1984, I was caring for a young woman in her 30s, and she had cervical cancer, and she was dying. And we were on rounds with the attending physician, and the attending physician was asking us questions. And I realized that the team and myself, we could rattle off 20 causes of the low phosphorus in her blood. But when it came to whether or not we were going to resuscitate her, we would scribble that in pencil on the nurse's notes, nurse's cardex, often not really discussing it with patients. And so I thought, even if you thought that hypophosphatemia and death were equally important problems, the rigor with which we approached one so outstripped the way we approached the other. And I think that spirit was also captured in the Joint Center for Bioethics, but also in its precursor. And I think, as everyone knows, the precursor to the Joint Center for Bioethics was the Center for Bioethics, which was there from 1989 to 1995. It was funded by the Ontario Ministry of Health. And I want to particularly acknowledge the leadership of a very singular person and leader who laid the groundwork for that, led that center, and laid the groundwork for the JCB, and that was Fred Lowy. And I've had the opportunity to be with Fred many times in the past few years, and his vision continues, and just really to acknowledge him. I'll also have the opportunity to acknowledge other contributions as we go on in this conversation, where I think we're going to touch upon 3 areas. The clinical ethics area, which really was the foundation of the JCB, the education generally, and the graduate education, which is that really, I think, singular accomplishment of the graduates and what they have all done. And then finally, the global challenges that JCB has addressed. So Jen, you asked what was going on at the time. I think it was an attempt to balance essentially a reform movement, a needed reform movement. It's not a criticism, with the actual practical tools that doctors, nurses, all allied health workers, and actually also patients and families could use to gain improvements in their own care and to improve the quality of care.
Yeah, it's such an interesting moment where there was an opportunity that opened up, which was, so we have the academy that has been deliberating on, or you described it as advocating from the outside, and then there was a state of readiness, if I could put it this way. Like when we think about the initial partners of the Joint Center for Bioethics, of course, there was the university and the academic disciplines there, but there was also this, like the receptors were some of the large hospitals in the area who were saying, this is no longer an academic matter for us either. We actually want to see, we actually recognize this is an area of expertise that we need to practice, which was, that sort of partnership that emerged there, I think was something really, really unique when I look at other bioethics centers around the globe. But they really stood out. It was actually a point of, other bioethics centers said, how could we do that here too? But I think what it also reveals, I remember this distinctly, is that on the one hand, it was like, how do we move this area of expertise into clinical settings when, one hospital had one part-time bioethicist, another one had maybe one. And it was like, there was this real sense that this is not a solo practice, that in fact, there needed to be coalescence, there needed to be a community of practice in clinical ethics. And when I look at where we are now, we have in the Toronto area, some 50 plus practicing healthcare ethicists, which started with just a small handful. And so when we see that growth, it really started by recognition in the health sector that we need expertise here. And at the same time, the field of the professional bioethicists saying, we need each other. We could start to see how there was that creative push and pull that created to what was then called the Clinical Ethics Group. And then later, the Clinical Organizational and Research Ethics Network of all of these professional bioethicists. So there is, there was, you can't recreate that necessarily. It's just like there was something and there people were ready for that kind of change. So, the other thing that it really stood out about what you were saying was it was about actually having impact. And maybe this is part of what I acquired by sort of being in the center as a graduate student, but I've always thought of bioethics as not a noun, but a verb. And it's always sort of calling us to say, well, it's the difference we may be wanting to make here. And you touched on clinical ethics as one of those areas in particular. It's almost like that's where we started, was thinking about clinical ethics. And I would also say its companion and research ethics too. Those seem to be the two starting points for some of that collaborative work that we engaged in as a community. So that was part of where you were at too at that time too. There was some real opportunities happening in terms of ethics and patient care that you were leading on. So you were also a physician, you were also thinking about education. Like, to say a little bit more about how some of these things came together. Like there was a lot of collaborative work happening on end-of-life care at that time, especially.
Yeah, and just one of the things we'd love to talk about in the interactive session, and here's people's views. In the 1990s, 1995, 1996, when the JCB started, bioethics was a new and growing field, and clinically and otherwise. And now I have the sense that it's a more mature field, and you'd expect that 30 years later. Mm-hmm. So what does that portend? Where is the field at? Yeah. What does that portend for the future of the field? What does it portend for the future of the JCB? Would love to just throw that out as a question for people online to get your views. Focusing specifically on clinical ethics, it was really the moral center of what we were doing. We very much, I think, incorporated some of the writing at the time of Ed Pellegrino and Mark Siegler, who described the clinician-patient relationship as the moral center of care, and I've tried to illustrate that in the story. It was also the fundamental business model of the Joint Center. Its organizational model was a strategic alliance. I remember we started with 4 hospitals, yeah. and the issue was the letterhead. And we had 4 hospitals and the University of Toronto on the letterhead. And it was almost like provinces in confederation. Given how hot bioethics was, nobody wanted to be not on the letterhead. So you saw, we use that very prominently as a tactic almost, but it shows how I think the Bioethics Center was adding strategic value. It had a board of the CEOs of all the hospitals and the deans of the relevant faculties. Its financing was from the university and from the hospitals. So that kind of organizational model and strategy really aligned. The argument was that it was more efficient and effective to do that together. And that was the argument at the time. And as you said, we had joint activities like an advanced directive research group that came up with joint recommendations that were then applied in hospitals, or the Joint Center for Bioethics Living Will, 100,000 of which were distributed. This was before the internet, when you actually mailed them out and you knew there was actually demand then for your services. So that was a fundamental model. It was the fundamental strategy. It was the moral center. And of course, there were other precursors at Sunnybrook. Eric Meslin, John Sen, Don Cowan had developed a very effective and very early bioethics center. At Sick Kids, Abby Ann Lynch, who had a lot to do with the development of bioethics, and Christine Harrison were developing their work at St. Mike's, George Webster. And we brought all that together. And a particular shout out to Sue McCrae, who had a large role in making that happen. So I guess my question to you, Jennifer, is the organizational model is different. The opportunity is still there for people in these institutions to learn from each other. And the whole is in some ways still more than the sum of the parts. Where are we in terms of the evidence that bioethics has actually improved patient care? What are the best examples as you look back over 30 years of joint learning across those institutions to improve patient care quality or more broadly? That fundamental thesis still applies, even if the business model has changed. So clinical ethics, yes, very exciting. And by the way, let me just say, this will bridge into our next topic. We made an explicit decision not to weaken the rigor of academic standards or the rigor of intellectual standards or scholarly standards in that clinical application. So the idea was to keep both very, very high intellectual standards and scholarly standards in bioethics, and our colleagues in the university helped us very much to do that, and to maintain excellent practices throughout the health facilities. What an opportunity. What was ultimately then, I think, 13, 14, maybe 15 health facilities working together, the biggest conglomeration of clinical ethics activity in the world, I think. But Jen, back to you. The fundamental thesis of quality care, the measurement, the evidence that actually happened. What, as you reflect back and as you look forward, what do you reflect upon? What do you see in terms of the field and the JCB?
Well, I mentioned earlier, there was this coalescence of the practicing clinical ethicists coming together to create this network. And it really was, I think, a time where there was a real attention and care given to quality improvement in the practice of clinical ethics. And we saw a proliferation of working groups around emerging challenges and topics that could range from, you're right, advanced care planning or uninsured patients, or even thinking about, say, priority setting within health institutions. But the other thing I just want to sort of layer on top of this was around the aughts, I started to see much more attunement at the organizational level too, about thinking, how do we create organizational contexts that foster ethical practice? We're going to build some infrastructure in terms, and we build out our bioethics teams. But we're also, what about training some of our clinicians as well to be participating in that? And then how do we ensure the organizational environment in which they find themselves, that is actually operating at an ethical level too? So I think that not long after there was sort of this really intense area of work around clinical ethics, started to realize that we needed to be shifting our gaze towards organizational ethics and increasingly moving beyond. So I feel like in some ways we are at a point where there's always sort of this sort of expansion and contraction as we try to learn and develop, like we stretch the boundaries of what we know, and then we come back to how is that informing our practices, and that involves managers, that involves policymakers, that involves a wide range of decision makers, all at the end of the day affects us as citizens or as patients or as caregivers or as providers, right? So I think that there's been, I think now, if I could make an observation, I think that there is a much greater attunement to the upstream conditions that informs the bioethics practices that happen downstream. And some of that has been institutionalized. So we see, credit organizations are now accredited for the extent to which they actually have an ethics infrastructure to support ethical decision-making, which was something that was not in place. But now we see that as a required or practice that this should happen. But there's one area that I think exemplifies the power of what coming together actually may do. And that was when in 2015, the Carter decision the Supreme Court of Canada ruled that medical assistance in dying would be made available to Canadians. The ethics community mobilized really quickly and thought, this is going to be tricky. We're going to need to think about this. But the key insight alongside this was, but we cannot go this alone. And how may we, by learning together, working together to develop, for example, model policies, approaches, educational programming, and other supports, how can we ensure that there's consistency across settings, but then also we're building in, as you pointed out, that rigor, that quality review of what is being rolled out, and doing it in a collaborative way. And that has continued. So with every iteration and a change in legislation, that group of 50 plus individuals across the province comes back together to say, and now what do we do? So that is, again, it's really seeing that what we can do by coming together amplifies the potential for positive impact and I'm just using that as one example. So, there have been numerous examples like that where I think that we found our stride in the aughts and up through our second decade, where we're actually mobilizing together around bringing broader systemic change that would affect institutions and direct patient care.
That's a great example, Jen. And when you think about the future, there's no shortage of those examples in Toronto, in Ontario, in Canada, and as we'll talk about shortly, around the world. And so maybe that's the mark of a mature field. And maybe one of the things we can do over the next year is reflect on those specific cases, if you will, and to see what the impact was and what the determinants of impact are, because it's almost a repetitive methodology where you're tackling a global or local challenge and trying to have impact. And the JCB, I think, and bioethics in Canada generally provides a good infrastructure for doing that. As I was reflecting, and that's the first of our second of our R's, reconnect, reflect, and renew. But as I was reflecting, I did think about the 30-year history in terms of the what, the issues, the challenges, and we'll talk about a few more in a minute.
Yeah.
But as I thought, what was really the greatest accomplishment of this 30 years? I think it comes down to people. We've talked about some people already. We'll talk about some more on the staff side, on the faculty side, and really pleased that we've got some old-time staff members like Rhonda and Brenda joining us actually online. But to me, it really came down to the students more generally and in graduate education. You talked about the collaborative program, which was on a very rigorous academic base. I'm not sure the JCB would have been successful without that, because remember, it was a partnership between the University of Toronto, the whole university, and all these health institutions. I'm not sure it wouldn't have been successful without some superstar scholars who were really helping to plan, helping to create, and actually teaching. And those are people, and I know some of them are also listening, like, Bernard Dickens, Wayne Sumner, Jim Till, people who were really, and many others, but people who were really at the top of their fields academically, and willing to embark on this journey. And they formed the basis of the JCB early on, the Center for Bioethics, the collaborative program. And then along came the MHSC, and things really exploded in terms of numbers, in terms of the types of people we were bringing in. And to that academic rigor, we added a focus on skills. So I remember two of the early courses in that original iteration of the JCB were about skills. They were about two or three of them, clinical skills. They were about teaching bioethics, where the MHSC students would actually develop a model seminar, give it to each other. They were about writing op-ed articles to influence the public, where we did that, and many of those were published. So there was this super interesting combination of academic rigor, practical skills, and just a shout out to Martin McNeely for really leading that. We had the domestic stream, which was super important in populating these positions in a growing field in hospitals right across Canada. But then the Fogarty International Center of the US NIH funded our international stream. And we brought in these tremendous folks from right around the world. And that was just incredible. I think we probably learned more from those colleagues than they learned from us. And they went on to start bioethics centers in their own countries. And just a shout out to Jim Lavery for leading a lot of that work. But, when I take a step back, Jen, I think the greatest legacy and the greatest asset going forward of JCB is wait for it, and you got these numbers, Jen, the 500 people or so that have been trained. And, not to mention the undergrad in nursing and medicine and elsewhere, and the postgrad programs. But those 500 graduate students across the collaborative program and the MHSC, that's an incredible treasure. And I really look forward to re-engaging with those folks in the coming year. And I know you're thinking about ways for them to re-engage with each other, and also to engage with bioethics across Canada and around the world, and bioethicists. So I guess one question I have, and maybe this is for you, Jen, maybe it's for the broader group, is what is the current market for bioethicists, the job market for bioethicists in Canada and around the world? Is that saturated now? Is that still a market as we go forward with those programs? And also, how do we best tap into those wonderful leaders in bioethics that we've had the privilege of being associated with through those programs over the past 30 years, to continue to energize and shape the development of bioethics in Canada and around the world over the coming year, and hopefully over the coming 10 years. So Jen, I don't know if you have any thoughts that you want to share on the people, on the students, on that, but just it's an unbelievable treasure that's there that I'm not sure we've leveraged and brought together, and as much as the potential is there to do it. And I hope that's what we can do over the next year.
This week is the first residency week of a redesigned MHSC program. We have students from 5 provinces. We've got from 12 different professional disciplines working in a diverse range of settings. And one of the magical things that happened today, I was speaking with some of the students, was thinking about, so who do I know in choose your Canadian city, Halifax, Vancouver, who is a graduate of this program that I could match you with? We have got graduates across Canada. And here's this opportunity that's like cohorts, building cohorts, or linking people to the expertise that's there, which we would not have had at the beginning. So I really do take your point. It is all about people, and it's about linking people and creating this broader community of practice to support our learners. But I think the other part of this as well, though, Peter, and I think it's something I've recognized, and when we were doing the consultation around the redesign of the MHSC program, we reached out to our graduates and we said, what do you remember most? And there were a couple of classes that they especially remembered, but they, what they remembered, what they took away most, and then they also we're recommending that we ensure that we're supporting people to do is to support not just talking about all the topics of bioethics, but really sort of cultivating mindsets or a set of skills to work with people around really difficult ethical issues. So it's a different type of thinking about bioethics that, you know, it's sort of an evolution in pedagogy within bioethics that is focusing on the embodiment of bioethics work as opposed to sort of summarizing the key topics of. So this is a really exciting time. And one of the other things that we heard from our graduates was how much they appreciated people coming from other jurisdictions, other health systems, other locals, and bringing that into the classroom. And we are embarking on that again with a pan-Canadian program right now, which I don't think we've seen in years. So it's that's really exciting. So sometimes when I look out the world and I think, oh my gosh, we've got so many big, hairy challenges that are wicked, that are moving in the direction of polycrisis. Where do I find my hope? I find my hope in precisely the folks in the room that I've spent the last 2 days with the graduates who we're going to be connecting them with, and more broadly. And of course, these are 500 graduates around the world. So I do think that that is a legacy, but it's also our way forward is to think, but wow, just imagine the impact of these emerging bioethics leaders and what they might be able to do. It's exciting.
Yeah, no, very much. And so I have a message for those 500 graduates, many of whom are watching now or will be watching as this is rebroadcast, and the 200 faculty and staff that have been associated, 700, 800 people. My message to you is please join us over the coming year. It will be wonderful to reconnect and really dig into how we can reinforce each other and how we can continue to do that over the coming 10 years. And not only that, but I think, we're now at the point where the linkages among the different bioethics communities in Canada is actually quite strong. And I would have the same message to folks from bioethics centers across Canada and in fact around the world is please join us and let's really try to sort out where this field is at and how we can take stock of 30, 40 years of lessons and leverage those lessons into better outcomes for patients and for people right around the world. And the right around the world actually helps us pivot to maybe the last topic we wanted to discuss, which is the global challenges and the way JCB has taken on over the years global challenges. My 6 years at WHO, for example, through COVID, showed me that the moral epicenter of these global challenges is really important. One of the things I admired about my friend Tedros, with whom I worked for 6 years and before that on his campaign, was that he was the strongest voice for global health equity through COVID, including on countermeasures, vaccines, and other things. But he was really advocating for that in a moral and practical way that was different from previous WHO directors general in a crisis. Similarly, when I think about an area like that, I think about SARS in Toronto, and I think about how we came together as a group across the JCB to study the ethical lessons of SARS. We published that as a paper in BMJ, but then translated that under the leadership of Ross Upshur into a ethical framework for pandemic ethics, which actually served as the basis later, and this is before Tedros got there, for WHO's ethical framework for pandemic ethics. I think about the Fogarty Center of NIH funding the MHSC. I think about the Bill and Melinda Gates Foundation funding the Ethical, Social, and Cultural program, which was basically doing clinical ethics consultations to some of the world's leading scientists, tackling some of those global challenges. like, for example, the work on Wolbachia and dengue, and that's a little intracellular parasite that you put into a mosquito so it can't transmit dengue, and it's now going to scale 30 years later as one of the most promising technologies in dengue fever, which is rising because of climate change. And I don't think that it would be going to scale without, at that point, Jim Lavery working with Scott O'Neill, the scientist, to actually engage communities on that, because not everyone likes little mosquitoes with intracellular parasites in them released in their communities. But they don't like dengue either. And it turned out they like dengue less than they like those mosquitoes. Here, and then, of course, the fact that JCB was the first WHO collaborating center in bioethics. It's still a WHO collaborating center in bioethics. That's a very, very important channel. And here, of course, shout out to Ross, to Solly, Benatar, who really helped shape the thinking, and of course to Abdullah Dar, all of whom really helped to globalize the Bioethics Center. And be remiss if I didn't also mention Rebecca Cook, because some of this global outlook was there, at the University of Toronto even before the Bioethics Center. So I guess, Jen, my question on this for you and for the group, and I know we're transitioning now to the discussion, is what are the challenges you think need attention now, and how do you see our community contributing to those global challenges going forward?
Yeah, thanks for the invitation to reflect on that, Peter. I'm really interested to hear what others' thoughts are as well. I think that one of the things that the COVID pandemic revealed, again, if we needed reminding, was just how interdependent we are on each other. And this is across borders. And it's reinforced the need for even different types of terminology. What does it actually mean to have solidarity with in a global way? But layer on top of that, you mentioned climate change. You mentioned, some resurgence of at least some types of infectious diseases, and polio, for example, is concerning. Layer onto that, we've got sort of a different kind of relationship, I think, in many of our states now, in terms of the extent to which institutions are trusted. And that, so these are, I think, moving in a direction where, as I was, discussing with our MHSC students a couple of days ago, we're moving into another phase in terms of how we think about health, how we approach this from a global perspective, that is in some ways unknown. I think bioethics now has an opportunity, and indeed, I don't think it's going to be called into be responsive to this, that we are going to have multiple convergent crises and existential threats at the same time that are going to affect the health and well-being of populations. And I guess the question that I have for myself, and indeed just for all of us in the field, is, are we ready for that? Are we going to inadvertently use the paradigms and the thinking of yesterday to deal with something that is calling us for the future? So I do think this is where this, going back to 30 years ago, the importance of academic rigor and some of that academic work together with the really hard work of being in the world. I think we're back at a moment like that, which might actually mean to ask the question, so what other disciplines are missing in bioethics right now? How do we which communities do we need to be thinking about as partners and allies in this work? So I see this both as we're on the precipice of a polycrisis, and on the other hand, I have this sense of kind of a pragmatic hope that we will nevertheless be able to influence the outcome by learning from the lessons that we've gone through in the past.
Yeah.
So,
and you're quite right. As you think about some of the challenges that are obvious, like AI, which you're already tackling, Jay will have a thing or two to say about that, and climate and the existential, but they all have a type of common ethical core. I remember in the depths of the pandemic, in the bowels of the WHO headquarters in Geneva, I was pulling out the papers that Solly and Abdullah and I wrote 20 years earlier on an ethical basis of caring, which, just to summarize, say that you can't really care about equity if you don't have a sense of solidarity, and you won't really foster a sense of solidarity unless you have a sense of caring or of love. And those are things that are hard to implement in real life, in public policy and global public policy, but they did constitute a type of ethical basis of, I think, all these global challenges that tends to be be the foundation of all of them, be it pandemics or AI or climate. Anyway, listen, I think really looking forward to what folks are going to say online, to some of the questions we've thrown out. And let me just emphasize how thrilled I am to stay very, very deeply engaged over the coming year. And as we plan the 10 years in terms of reconnecting, reflecting, and renewing what really is a jewel in the crown. I think it was described in one of the evaluations of not only academics, but also practical and public policy impact in Canada and globally around the world. So wonderful to be with you today, Jennifer. Let's see what folks have to say or to ask. And this is just the beginning of a conversation that'll dive deeper in those issues, and where we'll have an opportunity to engage personally with these wonderful colleagues around the world.
Great. Thank you, Peter. Right. So I think we're handing this back over to you, Jay.
Yes, thank you. Thanks for a great conversation. I mean, of course, everyone in the room and online, we have just a couple of minutes left, but we wanted to take this opportunity to get some traces of input in the form of a Mentimeter to a question, and there will be lots of opportunities for input like this over the course of the year. But what grand challenges should be the focus of bioethics scholarship or practice over the next 5 to 10 years? So with a Mentimeter, you can hold up your camera with most all sort of recent model phones. Hold up your camera to take a picture of the QR code there, and that should pop up the opportunity to lead you to a website. Or at the top of the screen here, it gives instructions. If you just open up a internet window and go to menti.com, you can use the code at the top there, 9408-5998, to come in and answer this question. So what grand challenges should be the focus of bioethics scholarship or practice over the next 5 to 10 years? And I think, Jen, given the time, perhaps we want to sort of share some concluding comments and have people enter their responses as we conclude. What do you think?
Here's what I'm going to propose. I'm going to propose that for those who can, why don't we extend this for another 15 minutes and allow folks to be able to share their comments in the chat, maybe elicit some ideas from the room. I'm already seeing the Mentimeter sort of throwing out some great points for discussion and reflection. So could I propose that we proceed in that direction, Jay?
Yeah, I suspect anybody who needs to leave will. Anybody who can stay, please do.
Absolutely.
Yeah.
Great. Wonderful.
And as Jen mentioned, for anybody online, if you can't access the Mentimeter, you can type your answers in the YouTube chat or email them to Terry, and I believe Terry will paste the email into the YouTube channel now.
Mm-hmm. So interesting. Peter, I feel like I'm doing a bit of thematic analysis on the fly here as we're starting to see some of the clusters of themes coming up here.
Yeah. thematic analysis, but also feeling. I mean, it's great to see people engaging, and look forward to doing more of that in person and
For sure.
and online. I mean, I think you're already tackling AI, which is at the center of that thing.
Yep.
You see climate change emerging. It'll be super interesting to take this, shape it, and maybe use it as a bit of a basis for what the next 10 years of JCB should look like. The trick, of course, will be picking one or two or three of those global challenges, or one to start with, or two to start with, and just tackling them. But those are really interesting results, Jay. I don't know if you have any comments you want to make on them. I don't think there's much more that I need to say, other than they have in some cases, a common ethical basis, and then a variable part. But super interesting to get more than 60 responses, and to get that kind of guidance from the community, and that kind of engagement, I think, is as important as the substance of this thing.
Absolutely.
I mean, I guess my gut response is about the diversity of issues identified. It's tempting, I think, as an academic, to try to synthesize and focus, but that's just my response. I don't know, Jen, if you want to offer further reflections.
I'd be interested just to hear what may be coming up in the chat, or from folks in the room, about, as they're looking at this right now, what is popping out for them that sort of stands out that's worth noting.
Okay. Yeah, thanks for that opening. Anybody want to offer a reflection, a comment about this, or anything you've heard today? Now it's too small. There's too many responses. Thanks.
That's a good thing.
Yeah. I mean, I think there are some pieces that we would expect to see. There's a cluster around AI, big data, privacy, data equity. There's a few additions around health equity, inclusivity, anti-oppression. There's the drug, fentanyl, and sort of the addictive drugs crisis. Already mentioned was climate change. But then I think other sort of core issues that remain really salient, like we talked about the role of medical education in shifting organizational contexts for producing a context that's ethics forward, or at least ethics friendly. I saw like genetic testing, and there's a cluster sort of around that, understanding where that as a technology, biotechnology may be going as well. Disasters, climate, disaster medicine, disaster ethics, international migration. I mean, really, these are the grand challenges, and I think from looking at these responses, this is a pretty clear call to action around thinking big and addressing, Jen, the language you used in your comments about polycrisis, how to sort of engage with that, find ethical ways into that. Any comments from the room? Thoughts? Yeah, thanks.
So one thing, I'm not sure, will you hear me? Yeah, that's not good.
So Jay, if I could ask, if you could repeat the comments that come from the room, then I think that those of us who are online will be able to better hear it.
Yeah, so one thing that I'm constantly thinking about, how? The how question. One thing, whether it's climate change, knowing how we need to act better, lower our carbon footprint, whether it's housing, knowing that is right, access to housing, care, health outcomes is so important. Respect to all of them. So the thing that I entered in here was around perverse incentives. So I think like sometimes we know what the right thing is. We know kind of the path forward. And then the question is, well, how do we get from there to there? And sometimes that means overcoming perverse, especially if we think of something like solidarity, right? So solidarity in the abstract, and we can all kind of agree in terms of what it means. But then if it has certain effects for our community, other communities, if there's some type of trade-off, then how do we overcome those trade-offs so that, we can produce optimal outcomes? We can really sort of address health equity. That is a lot to say again.
Yeah. No, that's great. Thank
Yeah,
you.
just bring some of these things together.
Yeah.
And how.
Yeah, I think really sort of crucial input around how to how to carry forward some of these themes in ways that have impact. Many of these problems seem intractable. And it's Jeff? Yeah. Jeff shared reflections about how perverse incentives interfere with our ability to make progress on many of these issues. So how to get around those in the very real context of people focused on different things, how to bring people along and produce meaningful change. So yeah, comments on that, Jen or Peter?
Well, I think Jeff has touched on what some of the heart of the challenge is. I mean, there are certain sort of entrenched practices and vested interests and ways of doing and being in the world that are being disrupted by some of these external forces. And some of those may be also the way in which for example, look at our institutions, or the ways in which we sort of differentiate what public health does, what hospitals do, whether or not bioethics should turn its gaze to issues like I notice here, like access to clean water and food. It's almost like redefining some of the parameters in the category. So, I mean, I think the perverse incentives are all over the place. So I guess the question may be, how can we, and Peter, you've mentioned this a few times, what at its heart is at stake here? I'm reminded of Hans Jonas's work on the ethics of responsibility. And Peter, you reminded me of this last year, where one of the things that Hans Jonas talked about was the heuristic of fear, that calls us not to sort of be stuck in the fear we can't do anything, but really calls us to being clear on what's at stake and then finding a path to clarify our responsibility. And I think it's pretty clear that this is not going to be somebody sitting in a closet somewhere deliberating. This is really going to be a much more engaged societal type of approach that we'll need to take. So maybe there are some changes in bioethics methods that we'll start to see. We'll need to do what we do differently in the past. So I'm actually quite excited and optimistic that we will find a path, but we're going to need to have our eyes open to some of the challenges, like entrenched interests and perverse incentives, as Jeff, you pointed out.
Yeah, when I step back and I thought, what are really the sentinel contributions, where's the center of gravity? Where's the momentum here over the past 30 years? Mm-hmm. Number one for me was those 700 people, maybe it's 800. And Jen, I hope you'll talk in a moment about your plans to bring those groups together, because that's really that's the juice that's worth the squeeze here, because there's so many amazing individual contributions of 20, 30 years duration right around the world and right across Canada. So that's one. But then number two is there have been some topics, shall we say, or some efforts or some initiatives that rose above the work of individuals that really represented a group effort. And we talked about many of them. They were, as far as I can tell, and this list may not be exactly right, but the end of life work, the quality end of life care work, the work on pandemic ethics that goes backward to SARS and maybe forward to climate, the work on MAID that you referenced. Before that, of course, the work on the clinical ethics and quality of care. And now you're deeply involved already in work on AI, which is at the center of this. So what is that, 5 or 6 cases that have risen to kind of a more collective level across the JCB? And what I'd like to know about those, and it gets a little bit to the point that was being made about how, is what has actually been the impact of those initiatives on those challenges? What have been the successes? And what have been the failures and what have been the limiting barriers? People don't often like to talk about barriers, failures, et cetera. But it's what a wonderful opportunity to look at those 5 cases, for example, and say, what have we been able to achieve? What have been the barriers? Where have been the failures? And what does that portend for the next thing on this thing? I'm a big fan of no peanut butter. You can't spread your effort across all these things. So you got 5 there in looking backward, and one of them is in play, or maybe 2 if you count the pandemic ethics. Certainly, there's a lot of clinical ethics in play. How collective is it? What's the opportunity for that? So I'd like to see some really good discussions over the last year about the impact on those 5, 6 things. Maybe I've got the list not exactly right, and how that almost the method of coming together to study them works, and how it's a comparative advantage over things like, it's not hard to get together a panel from a national academy, from WHO, but there's something special about doing it the way JCB has done it. What is that? And how can that be amped up in the future? And how can it be connected to some of those other broader processes, maybe?
Peter, it's been one of the things that we've been doing is trying to find people. Like where did our graduates go? And one of the most heartwarming and also revealing parts of this is that to find what people are doing in their own local settings, and you start to realize, they went and they have been transforming their local environments across the globe. And to be able to think then, so here's an opportunity. What if we brought us all back together? And we said, so now that we've learned all of this stuff out there in the world and we bring this back together, what more now can we do by coming together to do that? And one of the things I think that I'm really looking forward to, and I know we've talked about this as part of the steering committee, is to create opportunities for people to come together. Initially, perhaps more of sort of like a town hall meetings, bringing folks to be able to tell their stories of impact, what they're doing, what worked, what they're trying, where they think they would like to go. And also then to be able to see where there may be some opportunities for us to do more together than separately. So there's a little bit of, I think those town halls are a little bit of retrospection, reflecting back. But I also think those are those wonderful opportunities to then think, and now where do we go? Which all comes down to reconnecting with each other. I mean, this is where some of the tools that we have available for us to reconnect have changed. Technology's enabled that. We've got, folks online from diverse places right now participating in this conversation. But I think that there are other ways to do that. So I see the next 16 months leading up to what I'm hoping will be more like a homecoming, like if we imagine even a couple of days symposium, we're bringing everybody here if we can, as many who are able to, in Toronto, say November next year, is really seeing all of this as building not just towards a celebration at the end, but really about finding together what a path to the future actually looks like. And that to me is an exciting thing to be able to imagine, not just celebrate 30 years, but to imagine, okay, so what do the next 10 years look like? And how might we be able to do this together? And where are those things those invisible opportunities that we didn't even know? And what are those new lessons that we may learn by reconnecting with each other? Because we can become very parochial, but we can be stretched, we can grow, we can disrupt some of our thinking and actually bring about some really positive change. So I'm excited about this, and I'm hoping others too will bring their excitement and their inspiration to these town hall meetings and other engagements that we'll be having throughout the next 16 months, as I said.
Great. Well, let's see. You're planning these town halls. They're going to be, to some extent, affinity grouping. So people who might have been in a program together, who want to hear from each other, et cetera, to some extent topical. Yep. And you'd love to see everyone engage. I mean, why don't we ask the people in the room, Jay, and the people who are still online for some kind of show of their desire to reconnect, reflect, and renew. Is there a way we can get a sense of that, Jay, in the room, and and online. And of course, we're totally open to how to do that. You mentioned a broad-based steering committee that's acting as a sounding board, Jen, to you to help do that. But Jay, is there a way to get a sense of people's interest and enthusiasm to see their old friends again, and in so doing, reflect on what they've done, what's happened to them in the last 30 years, and draw from there the implications of that for the field in Canada and around the world, and for the JCB over the following 10?
Mhm.
It sounds pretty exciting. I see some nods. That's, I think, too general a question to pose as a poll, but it seems like a pretty engaged group, and I think people are pretty excited about that.
And do you have a way? I think there's more than 100 people online. Do you have a way of getting some thumbs up or feedback from that group, Jay, as we're sitting here to wrapping up?
Yeah, I mean, they're joining through YouTube, so but Terry's collecting all the comments they'll make. So you know, great to see expressions of interest in those comments. Yeah.
Great. And I guess the pledge that we can make is, you know, this is kicking off a thing, but we're really dedicated to finding ways to engage. I mean, ideally personally, and that'll culminate in 16 months in November 2025, as you said, Jen, but also in groupings online where we can have really a very, very highly interactive and engaged conversation, and just really hear about some of the amazing experiences, and just enjoy, I think, the feeling of seeing old friends again, and hearing from them. At the heart of this, the glue at the heart of this whole process is that feeling.
Thanks, Peter. We're so glad that we're doing this together and with everyone. So really glad to be part of this. It's really an honor. Jay, I think that this may be a good time to bring this first conversation to a close, and look forward to next ones that will be unfolding over the coming months.
Yeah, certainly. And we'll get to continue informally here in the room, and I understand Jen will be joining us shortly as well. Just a couple brief announcements before we thank our speakers. To receive the monthly seminar reminders and event digest, please email jcb.info@utoronto.ca. So Terry will paste that email address into the YouTube chat as well. And for CSB students enrolled in the seminar course, please remember to keep track of your attendance. And now, Peter, Jennifer, on behalf of all of us, thank you very much for this great conversation on the future of bioethics. So thank you.
Thank you. Great to be with you. Look forward to seeing each of you soon.